The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
So, one of the ones that I want to cover today is that of intellectual disability. Now, formally, it used to be referred to as mental retardation. However, the connotations with that term have unfortunately turned into a very derogatory term. So now the other term is generally considered derogatory. You might find it in old literature. That was the name that was referred to at the time, but currently we refer to this type of neurodevelopmental disorder as intellectual disability. Now, generally, the impact of this disorder can be found in specific diagnostic criteria. We would expect that this person has an issue with reasoning. They have a very hard time engaging in reasoning. And there are many issues in regards to the person's ability of being able to engage in problem solving. The next thing, and probably one of the most significant factors to consider, is that the person generally will have issues in regards to adaptation. Now, let's talk a little bit more about that. So, in regards to adaptation, the person may have issues in regards to personal independence and also in a sense of social responsibility. Something really specific, this type of intellectual disability, is that generally we would expect a diagnosis to be found with a person that has an IQ of 70 or less, meaning that the IQ of this individual is 2 standard deviations from the norm. The norm being for the average person is an IQ of 100. Now, you must be able to find that all these difficulties and challenges, we usually expect them to occur and they must develop before school. Basically, before the developmental period, we can start seeing these deficits in regards to that person and the symptoms. More importantly, in order to establish this diagnosis, there must be formal assessment. There must be a formal assessment. Now, let's talk a little bit about the severity, because the DSM does let us know there are different levels of severity. In order for us to work establishing how severe is the impact of that intellectual disability, generally we divide that in 3 manners. So first we have to understand how much the conceptual ability of the individual is impacted. I mean, for example, issues with reading, issues with writing, with mathematics, basically those academic skills that you may find in the average person. Another aspect to consider when we're looking into the severity is with social adaptation of that person. For instance, we will look into their interpersonal relationships, their interpersonal skills. Also look into the empathy that the person may have with others. And the last area that we will look into in regards to establishing the severity is that of practical domain. What I mean by practical, I mean matters of self-care or activities of daily living. So, for example, the person's ability to be able to brush his or her teeth or taking a shower, being able to manage money, right? So for example, making a transaction at a store when they're purchasing something. Now, let's look into the different categories in regards to severity. So the first one is mild. And generally, a person who has a diagnosis under the mild category, we would expect that person to be able to perform basic tasks, but that person may need help with the more complex tasks. Now, the next one would be moderate. And in regards to moderate severity, that person may require much more instruction in order to fulfill their activities or engage in complex tasks. Now, when we're looking into someone who has a severe concept, when we are talking about their intellectual disability, that person would need extended instruction. They would also need extensive support. Now, the last category that I want to look into is that of profound severity. And in this specific case, the person will depend upon another individual in regards to their activities and the completion of tasks.